Last time had my presentation, I demonstrated adjustment to everyone, and today I'm going to do something a little bit different. I'm going to demonstrate how I generally treat tendonitis. Depending on what sport you play, a lot of people get tendonitis. You know, tennis players, they complain of tennis elbow. Runners, I see a lot of Achilles tendonitis. Weightlifters, which Jerry here, he's a bodybuilder. I know he doesn't look really big like Joseph did, but he's in the lightweight division. But a lot of weightlifters, they complain of tendonitis around the brachioradialis and the forearm and bicep tendon as well. So I'm gonna demonstrate how I usually treat tendonitis, just to give you guys an idea of how I do that. So you would help me out here, Jerry. And on that flyer I passed out, it talks a little bit about some of the common conditions that I treat and some of the services we have at the office. So the main thing I do is adjustments. I demonstrated that last time. But we also do physical therapy. We have a full physical therapy suite, so we do exercise therapy with patients. We do different physiotherapies, which would be like your electric muscle stim, therapeutic ultrasound, cold laser, which I brought with me today. And then on top of that, we also have a massage therapist at the office too. So there's a lot of different services and different conditions I work on. As far as tendonitis, what tendonitis is it's the ending itis, that basically means inflammation. It's an injury of the tendon where there's inflammation present. So there's usually pain and inflammation. And how I treat it generally is with this instrument. What it does is it breaks up the adhesions within the tendon and muscle. Because what happens is it usually comes from overuse activities, someone doing the same activity over and over, and you keep re-injuring the area. Well, when you injure a muscle or tendon, it lays down collagen to sort of protect the area, and collagen isn't oriented the same way the muscle fibers are. It's sort of oriented in a haphazard mosaic pattern. So what we do with this is we just sort of break that up to orient the fibers the correct way and then let it heal up. Now it does usually cause a little bit of swelling and bruising. So I always tell people there might be a little bit of bruising, especially if I'm working on a female. I don't want their husband or boyfriend. But a lot of weightlifters, they have problems in this muscle belly up here. So it's pretty neat feeling. It sort of feels like you're going over pebbles, but you'll have some redness and you can feel just breaking up the adhesions in there. I'm going to go pretty light on him since he doesn't have any real issues today. But you guys can already see how redness is forming there. And after a while, you'll start getting these little red dots where the blood comes to the surface. And basically, like I said, I'm just breaking up the adhesions using an instrument to get in there. Massage therapy does work for tendonitis as well. This is just a little bit more invasive. You'll definitely get quicker results. Typically, if someone comes in with an acute tendonitis, a chronic tendonitis, it's been going on for months, typically I can get them better and back doing the activities they enjoy within about 4 to 5 treatments, sometimes less. So
feels kind of good.
Once we start getting these red dots up here, then we know that's enough on that area, and we'll move on.
Wow.
Once I sort of scrape the area and break up all the adhesions, I'll usually follow it up with cold laser. What cold laser does is it basically increases the metabolism to the cells. Your cells use a molecule called ATP for energy. It's produced by the mitochondria in there. And what cold laser does, it sort of kick-starts the production of this ATP, and it really increases it, so it promotes faster healing. It just makes your body do what it does naturally, just does a lot faster. So, and this laser is pretty powerful. They call it cold laser because it doesn't produce heat like a hot laser. As far as cold laser, this is probably the most powerful one you can get. So a treatment is only usually about 2 minutes, 4 minutes on a larger area. And sometimes you'll get some burning with it. If there's burning, then I'll stop the treatment. That's usually on like really fair, that's usually on just really fair skinned individuals that are super sensitive to sunlight. I've only had one patient have an issue with it, but it might cause a little bit of warmth and tingling, but generally you don't feel anything at all. So it's really good for sprains and strains and helps the soft tissues heal up quicker. You can also use it on disc injuries in the back and neck to help promote healing there as well. So that's about it. I mean, you know, doing a treatment on tendonitis might take me about 7 minutes, 4 or 5 times, and they're usually better. So I've had patients that have had problems for 3 or 4 months before they came and saw me, couldn't even barely lift weights anymore, or baseball players that had a lot of pain with throwing. So it's a pretty neat technology. It's a newer technology, and I don't know a whole lot of people around the area using either one of these things. Both of these are sort of newer technology. So, anyways, I'm Dr. Justin Shorts. We do have some health passes available. So if you guys know anyone that might be having back pain or tendonitis, anything like that, this will let them get their first visit for $20. I'll do a full orthopedic exam, rule out all the big, bad, nasty things. I'll take x-rays if I need to of the area, and also do the consultation. So this will get them in the door for $20. At least I can sit down and find out what's wrong with them. So I'll just set these on the table back there, and that's about it. Thank you guys.